Thank you all for coming out this afternoon. I wanted to give you an update on where we are with respect to COVID, and I so look forward to the day when I don't have to open with those lines. But for now, we're seeing a continuation of the Delta variant, not abating, and we're going to continue to stay ahead of this. As you've heard me say for nearly 45 days now, the focus is keeping young people in schools, returning people to work, and reopening New York State safely. So we all know the answer. It's getting people vaccinated, and that's exactly what we're going to continue focusing on. Where are we today? Let's take a look at that map. Trending downward, I'm liking that, but we still have some areas. North Country, come on, North Country, you can do better. I was up there last weekend and talked this up quite a bit. Our daily statewide is 2.34, which is good, but we have to focus on Mohawk Valley as well and some of our other areas, which I know we can do better. Extraordinary to me to see New York City, 1.29. Congratulations to New York City. I spend a lot of time walking the streets incognito, at least for now, and I see a lot of people wearing masks. Very good compliance, at least in the diners I pop into, or I have to show that I'm vaccinated. So those strategies are working in a densely populated area, which we know could actually be far worse, but they're actually working very hard to keep this down. Our hospitalizations, we track this, and I just wanted to point out on this graph here, we are paralleling where we were last year. The low point that you see was really the late summer, fall, and all of a sudden, that bump reflects the fall surge, the winter surge, and that is what keeps me up at night, seeing that trend and how we thought we were out of the woods, we were ready to declare victory, and all of a sudden it changed. And I'd like to think that that will not happen, but we're heading into the time of year where people are going indoors and lots of fun festivals and gatherings and holidays that are important to us. We did lose 38 people in one day, and that is just absolutely heartbreaking. The reality is we have to keep fighting back and get more people vaccinated. That's the same numbers we had last week in my last briefing as well. So that's very much on our minds. Regional hospitalizations. We're watching the ICU beds, but also this does not reflect the opportunity that these hospitals have to adapt quickly if necessary. I mean, these are still continuing in most cases. They're elective surgeries. That is something we know very quickly can transition to non-elective surgery, or only inpatient, and not have elective surgeries if they need to add up. But we're in constant communication with the leaders of the hospitals in these regions to be able to adapt quickly if necessary. Vaccination rate, still going up. Last time we had a conversation, we were quite a bit lower than this. We're still making progress, especially among our 17 to 12-year-olds. I want to do better. Let's get that done before their younger siblings will soon be eligible, which I hope would be before too long, the 5 to 11-year-olds. But 84% with at least one dose, almost 85, that's good. That's good, but we were always told last year when we hit 70%, we're going to be in great shape, and now they keep moving the goal line, and now we're being told about 90% is what we have to achieve. So we're within striking distance, but we have to keep pushing. We really do, and we're going to keep pushing younger New Yorkers to get vaccinated through our continuation of the pop-ups. They're fun. Kids like seeing these come to their schools. We're going to keep doing that. We've announced 120 sites over the 12-week period. A lot of people are partnering with us. I've been at some of the sites and community centers and schools, and I really do appreciate all they're doing for us. I want to just reflect on some of our mandates. We had a lot of coverage last week in terms of our hospital and nursing home mandate to be vaccinated. We have another one coming October 7th that adult care facilities have to be vaccinated by October 7th. And this is a good place to be in right now. And we saw last time a dramatic increase as the days wound down, and we're already starting from a good place right now. This is up from 77% when I took office August 24th, and we're approaching the numbers we need to hit. So we're seeing that those deadlines have a way of focusing the mind on doing the right thing. We appreciate everyone who's doing that. We want to talk about our OMH, Office of Mental Health, and OPWDD, the people with disabilities facilities. We want to make sure that we have safety in those as well. The ones that are hospital settings, we want them to have their first dose by the November 1st. And we'll start weekly testing for those who are unvaccinated. Again, this is a category where more people are apt to be coming in and out, not with the same care provider in other settings, but we're going to start focusing on this right now and reaching out to them to let them know these are our expectations. I don't think there'll be any surprise, but we'll have the full vaccine mandate for these hospital settings, which are analogous to the hospital settings that are already doing it, so this makes sense. This is what we're doing. We're very excited. I'm going to be having a call with the White House later this afternoon to talk about how we're progressing on a number of fronts, but one is when we're going to be able to get younger children involved. Pediatricians, get ready. We want you to start signing up to make sure you have full access to the vaccine so we don't waste a single moment once the approval comes. And pediatrician offices are the most logical place. You know, a lot of adults are used to going into a pharmacy for their flu shot. I've done that myself, but I think when it comes to your child, you're going to feel more secure in your doctor's office, and so we don't want to have any problems with them not being able to do this for families and making sure they have enough supplies. So pediatricians, please enroll so we can track you and make sure you have what you need. These breakthrough infections trending upward. We've seen more cases. 0.8% of all cases are breakthrough. People have already been vaccinated, and hospitalizations creeping up a little bit. Again, unvaccinated people still have 10 times more risk of developing COVID. And that should be the headline. 10 times the risk of developing COVID, and also more severity when it does happen, as opposed to someone who's vaccinated. But I'm on a daily basis now encountering people, talking to people, hearing about people who are in that breakthrough category. So there is a strong anxiety, and again, this is another conversation I'm going to have with the White House. When will we expect approvals for the other forms of vaccination? I'm a J&J person myself, waiting on that, Moderna as well. We're doing well with Pfizer, but we also want to make sure that those other vaccine brands are approved soon so we can get people the fortification that they need to have. So that's what we're concerned about. How many people have already had boosters? We're at about 303,000. That's just up from about a week ago. We had 147,000. So there is interest in these booster shots, which is great. And we have categories of people that know they're eligible right now, but I just want to see that expanded. I want to get to the point where they recommend that everybody get the booster shot, and I'll be having that conversation today as well. These are the categories where they're available now. As I mentioned before, it's 65 and older, underlying health conditions, high-risk settings, work in and live in high-risk setting. That means right now we have about 3 million New Yorkers eligible. We have enough supply. We're ready to go. Let's get those in people's arms to protect you from this, the unknown for this fall. And here's the high-risk occupations that I've covered before, but just want to remind everybody that if you're in these groups, classifications, we encourage you right now, if you've already had been fully vaccinated and you've had at least 6 months lapse, please get your booster shot. Also, this was a little unclear early on in the pandemic, what pregnant women should do. And want to make sure the word gets out that the CDC, FDA, and our own experts are saying that pregnant people who get COVID are higher risk. Let them know that they have a higher risk of severe illness and preterm birth. And people who are pregnant and want to get pregnant really should make sure they have that vaccine as well. And that was, again, one of those questions early on, but this just seems to be settled that it builds antibodies that might protect their babies as well. So let's get the message out to pregnant people. we just have to find more creative ways to get people vaccinated. And, part of it is just getting the information out about where to find a close one near you. It's hard to when you just take a second and realize last December, January, February, everybody wanted a vaccine, and you couldn't wait for your age group, and you couldn't wait to find out, is there a mass vac site near you, and where are you going to get it? And everyone just thought if we could only have access to that, the limited supply, everybody was so anxious about this. Now for many, many months, it has been so available, and we're just in a different situation, an unexpected one, an unnecessary one, where we literally have to find more creative ways to convince people that getting a vaccine is smart for them. One way we want to support people from other states is to say that when you come to New York, if you've been vaccinated and you have an app on your phone, that we're going to be the first in the nation that has an app created to validate passes from other states. Now, that's a good news story. The bad news is I think there's only 5 other states that have this. So it's a limited use, but I'm going to be working with our neighbors, especially in the metropolitan area, Pennsylvania, Connecticut, New Jersey in particular, and making sure that we can have individuals from their states come into our facilities, come into our theaters, go into our restaurants, and be able to have the businesses be able to download this app and be able to check the validation of a vaccine from another state. So we hope that this becomes more universal. We have a lot of people who are snowbirds. They go to Florida, and my dream was just to say, well, okay, if you've been vaccinated in Florida, you come up here, you can show it on your app, except Florida isn't really big into vaccinations, and that's another whole topic, so that's not working out for us. But we're doing the best we can, right? So this is really important for our comeback, for tourism, for businesses, business travelers. You want to have business travelers start coming back. It's really important to start filling our hotels and our restaurants. And you heard me yesterday announcing $25 million more to help restaurants indirectly by getting money to food banks and food distribution centers so they can purchase food from restaurants, get them into the homes of the people that they serve, and support, the restaurants will do better with that. So they're very excited about this, but we're just trying to hit this from so many different angles, and it's been a long haul, and we're getting as great. If you have any ideas, let me know. One was, let's lean into our sports teams, and I'm not taking credit for this, but I don't know if this has ever happened in the history of New York where all of our sports teams, and you throw the Yankees on top of that, that was a heck of a weekend. So we did have a lottery I mentioned a couple weeks ago, so we've had 13 winners and more drawings to go to. Just, you get vaccinated, you enter our drawing, and you've got a chance to see one of your favorite sports teams or get some of the paraphernalia, or even have a chat with one of our athletes. So that's what we're doing. We're trying to make it a little bit fun. I love sports. It's all good, but go New York teams again as we approach some more challenges this week. I'll stay tuned on that. But here's where we are. Let's wrap it up and just say we know the vaccine works. We know vaccine mandates work. We're going to be having to talk about some more going forward. Not my favorite thing to do, but sometimes it's necessary. And that comes down to just a gathering I had this morning, invited county executives to have a conversation with me about their challenges. And I was thanked profusely for having a mask mandate day one, because that took the pressure off them and their school boards and their school districts, that the state stepped in and said to do this. Same with the vaccination mandates for hospitals and nursing homes. It was not an easy decision because a lot of people's lives are affected, but I have to just be clear-eyed and laser-focused on the priorities that I must have as the governor of this state, and that is to protect people's health. And we feel confident that this is the approach that has worked. Give people enough notice, they can be fully compliant. At the end of the day, they will not go into a hospital or a nursing home. In their most vulnerable state, they're not healthy, they're not well, and they will not be exposed to someone who's supposed to take care of them, who then gives them the virus. That is what we've been working very hard to accomplish, and I hope that other states will follow our lead on that as well. It's all about just getting vaccination. So I'd be happy to take your questions at this time, and I got a feeling you have a few.
Yes, Governor, we're going to start off with Zoom, actually, if you don't mind. Our first question, your first question comes
Zooms first. All right.
from Maya Kaufman at Cranes, New York. Maya, your mic is open.
Hello, Maya.
Can you hear me now?
Yes, we can.
Great, thanks so much for taking my question, Governor Hochul. This has to do with the data on your vaccine portal and what isn't on the vaccine portal. I wanted to ask if you'll commit to releasing, and bear with me, I've got a list, individual facilities' number of employees dismissed for non-compliance with the mandate, facility level rates, and numbers of staff with at least one dose of the vaccine, since currently you just disclosed the percent with completed vaccination series, and all the same data for individual home care agencies, state-run psychiatric centers, and other healthcare facilities that currently have no individual data on your online vaccine tracker.
Happy to look into that for you. I absolutely want to be as transparent as we can. I just have to know how long it's going to take to gather all that. Is that available in real time? So we're just going to have to ask a lot more questions of our partners and get that information from them directly, and then process this and then get that out there. But I think we want everyone to have a clear picture of what's going on with our mandates. That's important to me. I just can't guarantee I'm going to have it to you tonight, but we need to gather it from the entities that have been affected, and we'll make sure that we get information out.
Thank you, Governor. We just have one more question from Zoom, and then we'll toss it back to the room. That question comes from Catherine Fung. She is from WNYC. Catherine, your mic is open.
Hi, Governor Hochul. Related to the first question, I was wondering if you could give us an update right now on state-run hospitals in terms of the vaccine mandate. How many people have been suspended or fired? How many are requesting religious exemptions? And what kind of staffing issues you're hearing about?
Again, this is information that doesn't come to us without us having to go to the individual hospitals and nursing homes affected. So I'll check on the status of that. It's a fluid situation right now because a lot of people are holding out until the court's decision on the 12th of October related to our exemption. Well, they think there's an exemption, the non-exemption for religious reasons. So that is why we don't have the clearest picture right now. We will have 100% clarity when that ends, and we'll see the pool of people who will be asked to leave, or those who have a conversion, so to speak, and all of a sudden decide it is in the best interest of themselves to get a vaccination. So bear with us as we want to get information out as close to real time as we can, but understand that this is the first time this data has been amassed or collected or even solicited, and we will get information out as soon as we can.
How many people are getting denied for COVID rent relief and excluded worker aid, and how many are appealing? The administration hasn't been releasing that data to AP. And do you think New York needs to allocate more money to those funds, and if so, how much?
We're asking for more money. In fact, I had a conversation when I had a call with the New York State congressional delegation, and Senator Schumer was on that. And the way the program is set up, and we received a significant amount of money, but as you all know, when I first took office a few weeks ago, that money was not getting out. There were people suffering, people who just were so desperately anxious about how they're going to make their rent payments, and landlords who really needed to get paid. They hadn't been paid in a long time. So we brought in experts, we brought in sharp people like Catherine Garcia and others to just supercharge that whole process and get the money out. And as a result, we are so successful. I'll get to the exact number, I don't have it in front of me. We are so successful in getting out to people that we're now running out of it. But I mentioned the congressional delegation. The program was set up to be able to reallocate money that was not spent in other states and bring it back to states that it requested. So we have a request in to the Secretary of the Treasury. That's the process we have to follow. We are very hopeful to get a yes on that question, and Senator Schumer and our whole delegation are working on that. But we'll keep you posted on that. So I don't know, but I can get for you later today the number of people who have received the money